If we had a prize for the most passionate interviewee we've come across, that prize would probably go to Jonathan Prowski, a psychiatrist in Toronto. Jonathan got really incensed talking about the overprescription of medication, particularly when it comes to feeding drugs to children for conditions like ADHD.
Well, Jonathan, just explain to me first about naturopathic medicine. Exactly what is that and what are you qualified to do?
Naturopathic medicine is I would say, a branch of practice whereby anybody who has this designation can do a lot of different types of treatments and evaluations. So for instance, when I see patients, I assess them and work them up much like another clinician might, with physical examination, with the ordering of blood tests and lab tests, offering a diagnosis or my clinical impression. And then when it comes time to treatment, I don't necessarily prescribe medications like a medical doctor might or a physician might. What I do then is prescribe natural health products, and under that umbrella comes things like botanical medicines, which are herbal medicines, nutrition, which also includes the orthomolecular use of nutrition, lifestyle changes like exercise and diet and so on, sometimes manipulation, much like chiropractic doctors do, homeopathy. So literally, when you think about naturopathic medicine, we do a very rigorous clinical evaluation, but the way we treat patients uses a lot of different modalities, and we're very well trained in a diverse amount of treatment options that we can provide to our patients.
And this is something you went into straight away. You must have known at the start of your career, this is the road I want to take, rather than the kind of more traditional medical route. How come?
You know, what's really fascinating about this journey that I've been on is I recognized early on in my life that people just weren't living well. They were living longer, but they were living sicker. And they weren't having the quality of life that I thought we all ought to at least strive for, right? So what appealed to me about naturopathic medicine was it's a system that's trying to optimize somebody's quality of life, trying to help somebody live not only longer, but live well while they're still alive. And I do think that's a much different focus. It's about quality, not just longevity. And for me, that really interested me as somebody who was looking at different career paths when I was a lot younger. It just didn't interest me enough to keep people alive or to give people treatments that may actually sustain their life, but not sustain and help them to regain a sense of good physical and mental health beyond just a level that just keeps them above water. So I'm very interested in any system that can afford people just the opportunity and capacity to live well and to live, I think, with a robustness, a vigor, just a real intensity and passion about living that I don't think any other system of medicine really does other than naturopathic medicine. Of course, I'm a little biased, right?
Just a little.
Yeah.
One of the legendary names that kind of comes up when you talk to anybody in this field is Abram Hoffer, and you've had direct experience of working with him. Tell me a little bit about him.
Well, Abram Hoffer was a very precise man. Everything that came out of his mouth emanated from a very biochemical worldview. It doesn't mean that he wasn't personable and lovely and nice and kind, and he had a quick wit about him. He was really just quite funny and humorous. But he really saw the world from a biochemical perspective, and he really felt that with good nutrition, particularly optimal doses of different micronutrients, he could really modulate a person's biochemistry in such a way that they would have better mental and physical health.
And you wrote with him, is that correct?
Yes.
About niacin
Yes.
and psychiatric disorders. Give me an idea of exactly what you did to treat people and how something like a psychiatric disorder can be helped by something like medicine.
Well, every day when I see patients in my own clinical practice, because I'm known as someone who treats people with mental health issues, of course I go through a rigorous evaluation. I want to understand them. I want to certainly learn about their life. I want to make sure that what they think they have is actually in fact what they do have. So I want to make sure that my clinical evaluation provides me with a good working diagnosis. And typically people who see me come to see me for depression or anxiety or even more severe forms of mental health issues such as psychosis, or also known as schizophrenia, for example. How do I treat these individuals? Well, ultimately it's about helping them to really embrace a different worldview. Patients who have been acculturated into the typical mainstream system have been acculturated as dependent people. They are basically in a system where they're told to take drugs for the rest of their lives, and that's the best that they can do. That's all they should do, actually. They should be on medications for the rest of their lives, because that is really the only thing that's going to give them the best chance of having good emotional regulation. And the sad truth is that couldn't be further from the truth. In reality, medications might be needed for a temporary period of time. If someone's floridly psychotic, there really are not too many avenues that are alternatives to hospitalization when someone is so acutely unwell. He or she would need to be in a hospital just to have his or her symptoms de-intensified. It's impossible to have a lucid conversation with somebody who's floridly psychotic because they're just regressed into their own world. So, I think there is a need for medication, of course. But when someone sees me and they're on drugs for life and they've been told that there's no other option for them, I get excited because I know there's definitely the potential to help somebody beyond just this one only paradigm that they've been told that they have to do. And it's a really coercive paradigm. It's not like a lot of people have a collaborative relationship with their prescribing psychiatrists. Well, I think psychiatrists as a whole are probably well-meaning individuals. I think the relationships they have with their patients are very paternalistic. I think patients are literally told to do what they're told to do. I don't think there's a lot of collaboration in that process. So when someone comes to me, it's a lot of collaboration. It's a lot of trying to understand someone's subjective experience of their illness and the challenges that they've faced and the hardships that they've had to overcome and what it is that they want to achieve when they see someone like myself. It's not just simply giving them natural health products and saying bye. It's about how can I help somebody live a better life with better emotional regulation without actually suffering from all the adverse effects that medications can cause. So when I give somebody treatment, it's really individualized to what it is that they want help with. But I use things like niacin, which is vitamin B3. I use essential fatty acids. I use magnesium. I use basically all the B vitamins, B12 in particular. I use vitamin C. I use, you name it. Basically, there's about 40 essential micronutrients that we need every day. And I try to individualize as best as I can what micronutrient combinations would help a patient that I'm seeing with mental health issues to have better emotional regulation. It sounds very simple in theory, but it actually requires meticulous collaboration over time so that I can figure out with that patient what is the best combination of micronutrients to afford them with the best possible emotional regulation. And often when that happens, they can actually have a reduction in their psychiatric drugs, and in some cases patients may no longer need their psychiatric medications. So it's a really exciting paradigm that was first introduced to me by Dr. Abram Hoffer. In fact, when I was a naturopathic medical student in the state of Washington, I had a very esteemed professor. His name is Dr. Alan Gaby. He's very well known in terms of clinical nutrition. And I can recall during one lecture, he said to the whole class, when Abram Hoffer has figured out something, or when he's written about something, it's usually true. And that stuck with me. After I remember that class, I went to the library at my university and I took out everything I could about Abram Hoffer. And that really began my love affair with his work. I became a huge admirer of his, and I couldn't believe it when I actually had opportunities later on in my career to collaborate and to work with him and to get to know him in some way. I wish that I had more time, of course. I learned of him later in his life, and I wish I had more time to really get to know him, but certainly the time that I had with him was precious, and it certainly did change the way I view health and disease. Although I'm not as biochemically oriented as he is. I don't necessarily see people with mental health issues as people who purely have biochemical problems. I think people with mental health issues can certainly do well when they receive biochemical support, but I think that there's so many other aspects of their care that they need that go far beyond biochemistry.
I suppose we're coming to this from the perspective of large doses, particularly of vitamins and other micronutrients. So, and I suppose in a sense, when you look how low the RDAs are, almost any treatment is going to have large doses. But can you give me an idea of how, when it's appropriate for you to be using niacin or C, how you do that? I mean, what sort of doses and over what sort of period, and the practical side of doing that.
Well, when Abram Hoffer first practiced, he did, when Abram Hoffer first practiced, he ran clinical trials on patients who were acutely psychotic. And he determined that 3 grams of niacin and 3 grams of vitamin C would be used to help these patients. And invariably the results showed that in acute psychosis, you can invariably improve the recovery rates dramatically from high doses of vitamin C and niacin. And he determined early on in his career that those were the doses that patients did the best on. But later on, he evolved his paradigm to include chronically unwell patients with psychosis. And among those patients, he would often start with 3 grams, but he would increase their daily amount, sometimes to far above 3 grams a day. So when I give patients niacin and vitamin C for their psychosis, for example, I probably start with 3 grams a day because I typically see the chronic cases. But I may evolve my treatment to use maybe 5 or 6 grams of niacin and maybe 3 to 4 to 5 grams of vitamin C. So really, as I said, one would have to tailor them to the patient, see how the patient's progressing. But the reason why we use such high doses is we're trying to influence something that is very disturbing to the patient. Patients who have psychosis often are very distressed by it. They're hearing voices. They may be seeing things that other people don't see. They may be having ideas that people don't agree with. So their life is going to be challenged because the reality that they have to live in is much different than, I would say, what consensus reality is. You and I at this moment can agree that we're in a room, and I can agree that I'm being filmed. Someone with schizophrenia might agree on some of those aspects, but he or she might also feel that there's other people in the room. They may also feel that they're hearing voices. They may also feel that the room's a little distorted, doesn't look the way you and I would describe it. So for them, their worldview is definitely different. And the reason why high doses are needed is it's trying to normalize the aberrant perceptions that people might have. So the reason why we need to use high doses of, for example, niacin and vitamin C is because we're trying to shift people's perceptual disturbances and we're trying to normalize them. And that's not going to happen with just the recommended dietary allowances. You can't give somebody the same amount of micronutrients that are found in foods and expect that's going to shift somebody's aberrant perceptual problems. It's just not going to happen. But what's really exciting about using high doses of micronutrients like vitamin C and niacin is that we can actually help shift people's, I would say, aberrant perceptions of the world and normalize them in such a way that they can function, I would say, in a much more comfortable manner than they typically do by being on drugs only. And the other thing that's really exciting about this paradigm is it's not about giving people maximal amounts of psychiatric drugs, a maximal amount of micronutrients. It's about treating somebody who's stable on medications, giving them micronutrients, and then lowering the amount of psychiatric drugs that he or she is on so that you can reduce the burden of adverse effects while also maximizing not only the impacts on their mental health, but also their impacts on their daily functioning and hopefully on their health overall. I don't know if people are aware of this, but if you just think about the antipsychotics that so many of the patients that I treat are on, they'll typically live on average 10 to 25 years less than somebody who's not on the antipsychotics, so they reduce lifespan, which is something that they're never told about when they actually are given the drugs in the first place. They get metabolic disease, so they have problems with their heart, they have problems regulating their blood sugar, and they often gain huge amounts of weight. Now, given the fact that these drugs cause such adverse metabolic impacts, it would behoove anybody to try to limit these adverse effects. So the wonderful thing about using high doses of micronutrients like vitamin C and niacin is not only will it afford people better functionality, less perceptual disturbances, but it can also reduce the burden of their psychiatric drugs so they can live longer but also live better.
That's fantastic. I had no idea of that. But then I also presume there are no negative side effects to taking niacin or vitamin C.
Well, I would hate to burst your bubble, but even with vitamin C and niacin, of course there can be adverse effects. But when we talk about the adverse effects from niacin, and we were to read them, say, off some monograph, they would pale in comparison to the adverse effects from psychiatric medication. But it doesn't mean that these are benign. As much as we can buy niacin and vitamin C over the counter, I firmly believe that one should work with a clinician who's really experienced, because they're not necessarily benign when they're given in very high doses, but they're definitely safe when in the right hands. These are not going to kill you. These are not going to shorten your lifespan. And they're really mostly very well tolerated if the proper guidance and instruction is given for their use.
And just to take a slight step back from it, when you're treating someone, accepting everybody's different and everybody has individual needs, but when you're talking about the doses that 5 or 3 or 5 or more grams, are you talking about per day or per dose? And how long does that last, or are you kind of weaning them off that, or is that something they will be continuing to take for the rest of their lives?
Well, I do think patients require anywhere from 3 to say 5 grams of niacin a day with equal or a little bit lesser amounts of vitamin C. And if they're doing really well, living a robust quality of life, then from my perspective, they should probably be on those doses for a couple of years at the very least before a reduction is made to see if they can still have this very good outcome and do well. So to me, it's really about them having a good collaborative relationship with a provider so that he or she can work with the provider and know how to adjust the doses over time to still maintain the positive results that were happening.
I'm also just thinking in terms of your work as editor of the journal, what does that open you up to, and possibly with that I'm wondering if you've been in this field for a long time, do you see a difference? Do you see younger people being more attracted to it, more people being open to things other than the traditional medical route?
Let me try to answer your question, and I'll come to it, okay? I'll be a little circumstantial here. Here's what people like me are facing now. The current climate of mental health care is abysmal. It's just god-awful. Because typically patients who have issues with psychosis are not just given one drug. They're often given combinations of many different psychiatric medications. And I refer to them as drugs because in my mind, these aren't the same as medications given for heart failure. Psychiatric drugs are not correcting any biochemical problem. They're actually creating biochemical problems in the brain, and it's a result of how they disable certain processes in the brain that they de-intensify symptoms. So they work on the premise that if you can disable parts of the brain, we can de-intensify your psychotic symptoms and help you. Now, to me, that's not a great paradigm because you're actually harming somebody to help somebody. And many of the patients that I see are on 3, 4, 5, 6, 7, 8, up to 9 psychiatric drugs. Believe it or not, I've had some patients on 9 psychiatric drugs in a day. That, to me, is nothing short of malpractice. That's disgusting. So I think when people are attracted to trying to help people in a way that doesn't involve medication, I think they're up against a lot. The climate now is totally different than it was when Dr. Abram Hoffer practiced. He didn't have to deal with patients on such complicated combinations of psychiatric drugs. So he was able to see the significant impacts that micronutrients like vitamin C and niacin would make. Nowadays, it's so complex because people come to us on all different, I would say, combinations of psychiatric drugs that it's very difficult to tease out what is an adverse effect, what is not, how do we lower one drug, how do we keep the other drugs. So I think if somebody's attracted to this profession, if they're attracted to helping people with mental health issues and they're attracted to using micronutrients, they have to have a thick skin. It's not a seamless process. It's very, very difficult. You're dealing with a much different environment than it's ever been before. People are now acculturated into believing they need all these drugs, so we have a sociocultural phenomena that sort of makes people believe they need these drugs to be well, when the evidence does not support that. So people have been sold lies about how psychiatric drugs are actually helping them, when in fact all they're doing is disabling various brain processes as a way to de-intensify symptoms. So someone like me is trying to work within that system. You can imagine how complicated it is. So to me, it's not a matter of somebody just wanting to use micronutrients. They have to sort of be really, really cognizant of how complex these things are, what happens to people when they're on all these combinations, and they have to really be cognizant of how they can integrate micronutrition in a manner that's going to help somebody and not even actually complicate things even more. So it's not for the faint of heart. That's all I have to say. As editor of the journal, it doesn't necessarily open me up to new ideas in the way that decomplicates things. Being the editor of the journal doesn't necessarily help me in my practice. You know what I mean? It's a fun thing to do, but ultimately being in practice is a completely different beast. Doctors now who are in, I would say, more natural medicine, who are really involving themselves in mental health, are now dealing with things no one could have imagined 15 or 20 years ago. You know, kids on 6, 7 drugs who are 6 or 7 or 8 years of age, that's just an abomination. That's inhumane. So we're not dealing with a normal set of circumstances. It's like we've landed on Mars and we're trying to bring everybody back to Earth. And to do that is incredibly difficult.
That's staggering, because I'd never thought of it that way before. I'm thinking all the time this is getting better.
No.
But my assumption just was, if someone is at an extreme end of poor mental health, that it's the same in Hoffer's day as it is today.
No.
But that's staggering.
No,
Really glad.
I would say the deception that does bother me is when people imagine it is the same. We're trying to apply the work that Dr. Hoffer did decades ago to the modern day, and it doesn't apply seamlessly. I don't even know if 3 grams is what my patient should need. I don't even know if they need more or less. The reality is we don't have the modern studies that have validated the work that Dr. Hoffer did decades ago. Unfortunately, that just doesn't exist. No one is that interested in his work other than people like myself or Andrew Saul and other people, because the enthusiasm just isn't there. Doctors are so acculturated into believing that the only paradigm of care is drugs and drugs only, that to imagine that you can use micronutrients to actually change emotional regulation, and even among people with psychosis, that's heresy, right? That's too good to be true. But the reality is, I see it in practice. I see people who can get well and live better when they're on less medication or no medication, as long as we do all this work and we try to figure out what micronutrients they require. But it's very difficult to say that what Dr. Hoffer proved decades ago somehow can just be implemented so directly into our modern day. It's not true. It informs my practice, but I don't base my practice on his work. I use it as something that informs how I approach my patients.
That's really powerful. I'm so glad you said that. It's really good. Just one thing you covered there, which I suppose hits home to me a bit, because my wife, as a primary teacher, a junior year teacher, has talked about the staggering increase of diagnosis of ADHD and issues with children, and it's all just medication. She has to give them their medication 3 times a day or 2 times a day, whatever, at school. So just tell me a little bit that might encourage people who have kids, going through these kind of issues, how you deal with that, if you've some kind of positive and encouraging stuff on that front.
Okay, so I'm going to take a step back again. When we think of a label like attention deficit hyperactivity disorder, and I think about myself, I'm 45 years of age at this moment in time. And decades ago, when I was in primary school, there was barely any kids who had significant, I would say, behavioral issues. There was definitely kids who had learning issues. I myself had a learning disability. And I'm thankful that I was born when I was, because if I had been born much later into our modern time, I probably would have been medicated. And it's not that I had anything other than a learning issue. I did not have a behavioral problem. But because ADHD has been co-opted as the label given to any child that has a learning and or behavioral problem, pretty much, it's become a catch-all diagnostic label. We are seeing now a huge overinflation of who gets that label, and as a result, we're seeing an overinflation of who is being prescribed psychiatric medication. And to me, it's nothing short of, it's disgusting, it's despicable, it's inhumane. We should not be drugging our kids, particularly when their brains are so vulnerable, they're developing. What they need is attuned, empathic, loving care that has to come from all avenues of their life. Most of the time when kids are expressing the symptoms of ADHD, what they're really expressing is the distress in their lives. It's coming out in some form. It could be family conflict, it could be abuse, it could be neglect, it could be poor nutrition, it could be a myriad of social processes. But because now we have this phenomenon of ADHD, and because again everybody's been acculturated into thinking that every childhood behavioral and or learning issue comes under the umbrella of ADHD, everybody is diagnosing kids in distress with ADHD, which results again into this massive drugging of children. And again, I don't know what to say. I don't know how to say it, except it breaks my heart. It's not the way a highly industrialized world should be tending to the most vulnerable. We should be giving our children what exactly it is that they need. They need time to run around. They need time to play. They need time to be crazy like everybody. They need time to actually have someone help them. We can't expect them to sit down all day and pay attention. They need to definitely have different learning styles that are more appreciative and understanding of how they learn. And I do think we actually should put less emphasis on having them stay in the classroom for as long as they do. We need to really bombard them with different types of stimuli, because we all respond better when we're given different experiences. When a child is in the classroom, for the most part, it's an auditory experience. They're listening. We need to engage them in a much different way. Otherwise, we're going to get very restless and unhappy children. If anybody just walks through a school, for the most part, it's goddamn boring. And you know what? I would be fidgety. And if with my learning issue that I had as a child, I would have probably been on medication. And God knows where that would have taken my life. It's awful. So to me, yes, we have this overinflation of kids being given the label, and this overdiagnosis and this overtreatment. And it's not leading to a better society. What you're doing is you're creating lifetime consumers of psychiatric drugs, and they're never going to live a flourishing life, generally, as a result of being loaded up on medications early in their life. It's just going to sustain throughout their whole life. So the impacts are tremendous. There's many, many avenues where we can appeal to these kinds of problems in a way that doesn't require psychiatric drugs. First of all, I think the psychiatric system is so enmeshed with our school system that it almost leaves no opportunity for any parent who wonders what other options are available, because they're basically being forced into a paradigm of drugs only. They can see their family doctor, their pediatrician, or a pediatric psychiatrist, and ultimately the same result will happen. They'll be put on ADHD medication, which are all stimulants, which don't work that much differently than cocaine. If you were to give an intravenous bolus of methylphenidate, which is Ritalin, and you were to also give an intravenous bolus of cocaine to the same individual, the exact same areas in the brain light up. They almost